Good evening and welcome to the Fall 22 semester Beyond the Front Page, a show produced by Cayuga Community College and broadcast on Spectrum, Verizon Fios, the Auburn Regional Media Access, better known as ARMA, as well as Win 89.1, the college's radio station. I'm your host, Guy Cosentino. A little over 2 weeks ago, President Joe Biden said on CBS's 60 Minutes that the, quote, pandemic is over, end quote. Since then, there has been a bit of debate whether that is the case. At the same time, we've seen recent data that shows an uptick in COVID cases in central New York, in Cayuga County, and especially in Onondaga County, if you've seen those maps that are on Channel 9. With that in mind, we've asked Cayuga County's Public Health Director, Kathleen Cuddy, back into the studio, and she has graciously agreed, and we appreciate her making all these visits over here to talk about COVID, her department's efforts to get the flu vaccine out, and the recent spike in toxins in Owasco Lake that serves roughly 60,000 county residents. We'll also talk about a new survey that she and her office are conducting. Welcome back.
Thank you. I'm glad to be here.
Thank you for doing this. I know you have a lot on your plate at your office, and we have been reading about it almost daily in the newspaper. Talk a little bit about a lot of different things. But first of all, how's your staff holding up?
It is a new world order right now with some of the regulatory restrictions lifted related to the pandemic. So we're regrouping and we're putting focus back on some of the public health programs that really had to be put aside during the intensity of the pandemic.
And I would hope that we could do shows on those things that are good works that your office does.
We look forward to it.
Okay, so we want to do that. So I want to go back. I want to start with the President of the United States. He said the pandemic is over on television. As a public health official, is the pandemic over?
Well, COVID's not over. Are we calling it a pandemic? It is still, right? Is it endemic? I guess that's for people who define those words to identify, not for me. But COVID certainly still exists and it's still impacting our community.
So do you think we just have to live with it?
Yes, we do. We have to try and reduce getting it and spreading it. And one of the best ways to do that is vaccine and staying home when we're sick.
Talk about both of those things because there have been some issues with that, especially locally. But I want to ask you, the last big surge, I think, and if I'm wrong, correct me, was Omicron, that variant.
Correct.
Are you worried as we get into the next winter phase that we'll get a new variant?
I think that's always a concern with viruses, that they tend to morph. We really watch what's happening on the other side of the world to anticipate what's coming our way, because we tended to after it's hitting Asia and Europe and Australia, it's coming around to hit the United States.
So let's talk about vaccinations first, not about staying home, but vaccinations first. So your department has been doing some vaccine clinics. I think it was about 2 weeks ago, 2 Saturdays ago. You were down at the old Peebles at the Finger Lakes Mall. I was there. Staff did a great job, as they normally do. Very friendly and moving people through. Very efficient. You might have to wait 15 minutes, but I don't think you're there 20 minutes overall. So what shots were given? Was that new shots? Was that boosters? What did you do there?
We've really targeted different clinics for different people's needs. So some of our clinics have been whatever you need, right? Whether it's a first dose, a second dose, a booster. We have every variety of the vaccine available in the United States that is available to people in
So just a quick question on
our
that.
county.
One of the big issues originally was this issue of refrigeration.
Right.
Are you able to get through that much that you don't letting it spoil?
We don't order so much that we let it spoil.
Okay.
So we're able to order in smaller doses. At one point in time, for example, Pfizer had to be kept sub-zero and you could only get it in 1,100 doses. That's not the case anymore. There's enough
So they have
ability
solved
to get
those supply chain issues.
Correct.
Okay. Sorry, I didn't mean to interrupt, but I know you were you needed to have big turnouts.
Right.
But you did have a big turnout at Peebles.
I'm really pleased with the people who are turning out for the bivalent dosage that's available now. We have both Pfizer and Moderna available for people.
When you say bivalent, what does that mean?
The bivalent is for this latest Omicron variant.
So
the old style plus the new style.
So you're doing Moderna and Pfizer.
Correct.
At there. And so these were people who had already gotten their first rounds originally, and they came in for their boosters.
Correct.
And this new version for the adults takes into account Omicron.
Yes.
And question, because I've seen a couple of stories on this. Do you mix and match? Do you stay with what you got? What's your recommendation?
It's really what you're comfortable with and what your healthcare provider may recommend to you. You can mix and match. So for your first 2 doses, your original, it's the same 2.
Right.
But when you get to your boosters, you have the option for Pfizer or Moderna to flip-flop either one. Now, there's also J&J is no longer available, but Novavax is now available.
So why is J&J not available?
We're not offering it.
Oh, okay.
It really was very much restricted, and it didn't become a booster.
Is it being offered
vaccine
in the United States anywhere, or is it now mainly overseas?
I really can't answer that. I don't know.
So another, not only the question about mix and match, left arm, right arm, same arm as you got your flu vaccine, because we're going to talk about flu. I've seen articles that say you should do one or the other. Any thought there?
What you're comfortable with. Personally, I like to have my non-dominant arm because sometimes you feel it a little bit, and the next day
Since you got that
fine.
Tommy John's, it's tough to toss that stuff, right? Okay. So tomorrow, and I know we taped this on Thursday the 6th, and this will play after this, but tomorrow you're doing a clinic for those who have not gotten their first round of shots, correct?
I believe that's the case. We have such a variety. I actually refer myself to our website to
Okay.
clarify. Yesterday we had one that was boosters. Tomorrow very well may be the
So I think this one's at
first round.
your office on Dill Street.
Correct, for Novavax virus.
Yes. And so can somebody just walk in, or do you have to make an appointment for that one?
We ask for appointments, but if we're able to accommodate a walk-in, we certainly will
Because
do
the
so.
Peebles, it was not. I was in the Pfizer line, so that was moving really quick.
Yeah.
Moderna was not moving very quickly.
Right. Initially with the bivalent version of Moderna, and that's still the case, we have a finite supply. So after our first experience with that, when we knew there was such a tremendous demand, we started doing appointments for Moderna. And so that way we know that we have the vaccine for the people who are arriving.
So you did the one 2 weeks ago. You did one yesterday. You're doing one tomorrow. Will you be doing another first shot vaccine again?
Yes.
Do we know how many roughly have not gotten their first shot?
I looked at statistics before I came that really said about 60% of our eligible population in Cayuga County has been vaccinated, which would mean their first 2 doses.
And I'm going to get to what we are compared to others. So that really means 1 out of 3
Are not vaccinated.
vaccinated. So if I walk into Wegmans, and I'm going to pick on them because that's where we all go to meet. If I go walk into Wegmans, I can be pretty sure that 1 out of 3 people I run into might not be vaccinated.
It's certainly possible. There is some zip code breakdown to some of the vaccination rates also. So if you are more rural and a less vaccinated population, you're coming to Wegmans, I guess that
Does it drive me
mixes
nuts?
it. From a public
Sorry
health
for
point
the
of view,
technical question.
well, I can say unequivocally that I am a proponent of vaccine no matter what. When we look at COVID, vaccine is helping prevent death. It's helping prevent serious illness and hospitalization. It is. Polio, monkeypox, all the virus that come out, all the preventable diseases that vaccine has helped. People who do not partake in vaccine, in my opinion, don't recognize the severity of the disease that's being prevented.
And not only to themselves, but to their communities.
Correct.
I want to ask about children. Let's go to these rates because we're talking about this. So I looked up the rates on the state tracker.
Mm-hmm.
Vaccination, you mentioned about 63% in Cayuga County have gotten at least 1 dose, I think, as of Friday.
Good.
That means, and 59% have fully vaccinated. So that really brings that number to 40%, which bugs me. That's in the ballpark that you've been looking at data.
It sounds like the numbers you're
So
reading.
I look at neighboring counties. Rural, urban, highly educated, we're below. I'll give you Tompkins. And I know that's always an outlier. But Tompkins, 84%, 1 dose, 74% compared to 59%. Onondaga County, 80%. High poverty rate, a lot of demographics of poverty. 80% one shot, 74% two shots, 15% higher than Cayuga County. Wayne County, very rural county. 60, more in line with Cayuga, 67, 63, still 4 percentage points above Cayuga. Any explanation? It's not your fault. Do you have an explanation of why?
I've got all sorts of thoughts, right? I think, unfortunately, COVID experience, the vaccine became very politicized early on when it's a public health measure, right? It's not about what your political outlook is. I think we need to keep doing more, right? We, as a health department, we're doing our part. We're reaching every area of the county. You know, we did vaccine clinics at all the school districts, all the volunteer firehouses. So
it's not an access issue.
It should not, at this point in the game, it should not be an access issue. I think it's going to be one-on-one conversations with healthcare providers and trusted individuals that will make the difference for people who have been hesitant.
I did not slice and dice the data. I'm really good at looking charts real quickly and looking at them real quick. Do we know of that 40% roughly? Do we know the demographics? Is there a demographic shift between male and female or by age? Forget rural. I get the rural issue.
Our older group, when I say older, I mean like 75, 80 and older. Super. Well vaccinated.
Hit it out of the park. They are. Okay.
They're outstanding. Our 20s through 40s, not as great. And that age group then influences, because they're more likely the parent age group as well. So that influences what their children are doing also.
And do we know about children? I want to get to children, so we might as well get there. Do we know where we are with children on? I know there's a new, you mentioned a few minutes ago, we're waiting for the new Omicron for 5 to 12s. And it sounds from the news reports that could be any day now.
That's my understanding.
We're in that process, correct? So we're waiting for that. If that comes out, will your office be doing 5 and 12s? Will you go to schools? Will it be up to schools to say whether you can come in?
I think there's a little bit of both. We certainly will make ourselves available to any school that wants us to come and provide some vaccines for COVID. You know, we had such great partnerships, really, with all our districts. A silver lining of COVID, right? It forged even stronger relationships our department had with a number of other community entities. So we will certainly make it available, and available at times that should be conducive to that age group and their guardians, their parents, their families.
So you may also do clinics as well.
Yes.
Is there a nasal version for the COVID vaccine at this stage?
Not to my knowledge.
Do you think there will be? I mean, I know that children sometimes have a dislike of needles.
Yeah. Adults do too.
Well, if you've ever been into, you know which room at Dr. Graney's is giving shots. Sure. God love those nurses in that office. But in many cases, though, for me, maybe I'm perceiving it different. I think the needles are different for Omicron than they are when we used to get a tetanus shot or something like that. Maybe not. But do you see nasal at some point? It's just not the highest priority right now.
It is not the highest priority, certainly. You know, if the vaccine sticks around, I certainly could see it happening, because we did for flu, right? A nasal became available. So it certainly could happen.
Do we have an idea of how many people died from COVID in Cayuga County?
153.
Are you surprised it's that number because it's high or low? I know you can always say it could have been worse.
Right. I will say I'm pleased it is not higher. I think we really, as a community, had a terrible winter, that first full winter of COVID, and some of our nursing facilities in particular were just slammed, and it was awful for everyone involved. So I think some of the regulation encouraging and requiring vaccine amongst healthcare workers and nursing home residents has helped make a difference in that regard.
Have those requirements lessened in the public health field? Not in public health, but in the public field, public employees?
So healthcare workers, if they work within certain categories of healthcare, do still have the requirement to be vaccinated for COVID. All the boosters are not required. They're encouraged, certainly.
Should they be? Should I'm not saying this being your decision.
Right.
Has at some point the federal government said, you know what, I have a friend who I used to serve in government with who said the juice is not worth the squeeze. And sometimes you just got to say, oh, well. But my question would be, would you say, oh, well, in a public health issue?
No, I would not, because that's not doing my job, right? I also think I can't say why we have such a need for healthcare workers entirely. I've got some perspective. I don't think the vaccine was the trigger that limited or had healthcare workers leave, go on to new jobs, not get into the field, because there's requirements for vaccines for other diseases, not just COVID. So that's not the compelling factor from my point of view.
So one other slice and dice, and I'm not looking to hold you to it, but of that 150, there are some deaths that occurred prior to a vaccine.
Right.
Of those, do you have an idea of those who could have been so you got to give it a relative, let's say 2 months. Once a vaccine was out last year, it was last year, wasn't it? Time flies. So let's say you're in March of last year, when some people could have by then gotten both shots. Are more of the deaths, do we know if more of the deaths were related to those people who did not get vaccinated or got vaccinated, or we just don't know?
You know, I don't have those numbers in front of me. We certainly saw the greatest intensity in a short period of time of death during the winter time. And we've seen some of our deaths certainly followed some of our spikes in illness. But that's a good question. I think I have some data back in the office with that we probably should make more visible to the public.
Okay. You're always welcome to come back on to talk about that and other things. So you also mentioned about staying home.
Right.
That becomes a challenge with a high poverty rate where people are sometimes hourly workers and they're like, I got to go.
Yeah.
And I got to go work because if I don't have food, or I don't have fuel, or I don't have fuel for my house or gas for my car.
Yeah.
How do you address that particular issue?
It's a real challenge. Ideally, you have employers who are understanding. Ideally, you have, a workforce who doesn't take advantage of a situation.
But at the same time, you have employers who just can't find people.
Correct.
So they may want to say, you know what, you're not feeling well, stay home. But I still have to have somebody on cash register for.
It's so, and that's where you have to be creative with management, right? You might be behind the counter person who's going to work the cash register elsewhere if that's the need. And I guess that's where we have to learn bench depth, and we all do our part. It's better to keep the staff you have healthy than have, be closed down for a week because you don't have staff due to illness. Last
question on COVID, believe it or not. What's your biggest worry going into the winter?
I hope we don't see increases like we've seen the past couple years of illness. I'm really hopeful that there'll be enough vaccinated people. There'll be enough people who stay home and wear a mask if they need to, isolate themselves when they don't feel well. Do the best you can to protect everyone in our community.
So this is flu season.
Yes.
You can get your flu shots now.
You can.
Is the county offering them?
We're not open to public clinics at this point in time. We haven't done public flu clinics for quite a few years. But depending on the amount of vaccine that we get in hand, we'll certainly help support the cause. And
so you can go to Walgreens or, I'm not going to name them all, Tops or Wegmans or whatever.
The pharmacies have flu vaccine. Healthcare providers have flu vaccine.
And why get a flu shot?
So you don't get the flu. And so that you don't.
It's not 100% guarantee, though.
It's not. It's based on what happens in the southern hemisphere before it hits the Northeast. That's how our vaccine is developed. I will say to go back when you speak to flu clinics, it used to be, for those who are old enough to remember, the county held flu clinics for adults. We're not doing adult flu clinics, but we do have some child flu vaccine.
And you have nasal at some point.
And we are anticipating, we didn't a few days ago, but we have an order for some nasal, so children can make appointments and get their flu shots with us.
I know a set of parents who are going to be happy about that.
Good.
So I want to ask you two things. When you mentioned masks, so I'm assuming, and if I'm wrong on this assumption, flu was really down the last 2 seasons because most of us were masked up, either because we were smart enough to mask up or we were required to mask up.
We believe that played a role into it. We believe that played a significant role. Yeah.
So I walk around now and I don't see a whole lot of people in masks. Mm-hmm. I see your staff in masks. When I went to the flu clinics, I think everybody who was administering or doing intakes or everything had a mask on. Do you think that we will see a massive jump in flu this year because there are no mask mandates?
Yes, I think we're going to see. Our understanding is that flu is already in our county. Mm-hmm. We have some diagnosed cases. It's throughout the United States. Word is in the public health fields, it's going to be a tough flu year. And illness, that's why we want people to seek health care. Yes, you might have COVID. Yes, you might have flu. You might have something else. There's a lot of viruses going around, and there may be treatments for those viruses also. So we know that there's COVID treatments. We know that there's flu treatments. You really want to get diagnosed accurately to help your symptoms not progress.
And the idea that getting the COVID vaccine and the flu kind of go hand in hand.
Perfectly acceptable and strongly encouraged.
Okay. Let's talk about water. I think you were a daily guest on Channel 9 News about 10, 12 days ago. I'm sure your mom loved watching you on television.
Sure.
So there was a sharp rise in toxins being measured in Owasco Lake. Correct on that?
In the water treatment systems, who tested the raw water.
And by the way, who did the testing?
There's some in-house testing, but they ship out to a laboratory also that's certified.
And the city test on a daily basis.
They do some testing and inspection every single day, sometimes multiple times a day. Plus, they use a laboratory.
And then, at the same time, those numbers have since gone down, correct? First of all, let's ask, why did they go up?
That's $1 million question, right? We had a lot of discussion about that. Water temperatures, the depth of where the HABs are hanging out in the water.
HABs are?
Harmful algal blooms.
Okay.
Thank you. And that's what the microcystin that creates toxin is what's analyzed. And when we talk about some of the numbers regarding the raw water and our concerns about toxin getting in the water. So
as we got closer to fall, and if you've noticed, the temperatures dropped around here, as we have frost advisories all the time now, do you think that lowered the toxicity?
I think there's so much we're still learning about HABs. This summer, it was a drier summer. We didn't see the blooms on the lake like we have in past summers on Owasco Lake. There was only,
2 or 3 beach closures in Owasco. There were a couple in Cayuga.
On Cayuga, yeah.
But I was surprised at the lack of.
Yeah, not nearly the numbers we've had in the past.
Summer camps get to stay open.
They did, yeah. But are we not testing in the right places? Can we not? Sometimes it's just the fluke, right? It's so ephemeral. Some of these, the blooms happen and then they disappear so quickly.
And I know some of this testing, and we'll hopefully have Dr. Adam Effler on, who does some of the testing. Does your office do testing too?
We don't do the testing. We send things out to a lab and send samples out.
So I think the most often asked question you were asked 2 weeks ago is, Auburn's water safe?
Auburn's water is safe. Owasco's water is safe. The treatment systems that are in place worked exactly how they're supposed to work, and they continue to work exactly how they're supposed to work. I drink the water.
Okay. So I will also ask this because I do think it did come off in at least one newscast that someone, they did not name the public official, I don't know who it was, said you still should keep a supply of bottled water at your house for consumption. Should they? And is that a legitimate precaution you should invest in?
It is a good idea for all sorts of reasons. HABs could be a thing, a broken water pipe could be a thing, a low water pressure could be a thing.
A blizzard could be a thing.
A blizzard could be a thing that requires
Optimism
you
about snow.
and you benefit by having water on hand. And the wonderful point is you can take water right from the tap right now and store it on a shelf. Put it in a glass container, a food grade container, put it on your shelf. You don't have to go out and buy the New York State certified water, although you can.
Is there an expiration on those plastic bottled waters that we should be paying attention to?
There is on the.
So pay attention on the side.
You can. I can't speak to exactly what that means and what type of degrading may occur, but we would encourage people to flip them over every 6 months or so.
Deanna Ryan of your office, who's been here as a guest several times, sent us a piece that we're popping up on the screen asking that your department and Auburn Community Hospital are asking for public input on health-related issues. What are you asking for? And there's a QR code on your card, and Jeff Zazniak tried it, so we know it works. And if it doesn't, call him.
Good. So get your smartphone ready now, people.
What are you asking?
We're asking people to answer the survey. It's called our Community Health Assessment. It's really helping people prioritize what's important to them throughout the county. We would like to get input. We, meaning the hospital and the health department, utilize this data along with statistical data that's put together and analyzed. We have an agency who's helping us support that. And we look at this information, and we are required to formulate programs and services.
So part of this is mandated.
It is. Part of it's mandated by the state so that we are providing services that meet the needs of our community.
So what type of questions do you ask?
We are doing things a little bit differently this year, and we put some prompts to make really a checklist a lot easier, a lot faster. There's room for narrative for people who want to be a little wordy, but what matters to you? What makes a difference? Do you have a healthcare provider? Yes, no, I go once a week. There's all sorts of.
But are you asking questions about tobacco usage, pregnancies?
We don't ask so much about the personal use. It's about your experience engaging with the system and your experience and awareness.
So it is for people who utilize the healthcare system,
correct,
however often, and those who don't, who might need to.
Who might need to.
But you want them to participate.
We do, because there's a lot of preventive activities we can help enhance.
And where will that data go then? What happens to it?
So that data is going to be analyzed by a group called RMS. They're going to give us some feedback, and then the hospital and the health department will work together and create a community health improvement plan.
And how long is this survey? Right, and the posters are all over. Ryan's done a great job. How long are the?
About 2 more weeks. We definitely want to, by the end of October, we want to have the survey wrapped up.
So 2 final questions. One is Dr. Anthony Fauci, the director of National Institute of Allergy and Infectious Disease, is retiring at the end of the year. But he's in your profession, or you're in his profession, whichever way you want.
Yeah, I would say that.
How do you think he did?
Oh, I think he's fantastic. I'm a big admirer. Yeah, I think he's a straight talker and he walks the talk.
Last question. As a public health official, as a mom, as a daughter, what worries you right now on a public health perspective?
The various diseases that are coming forward, and what worries me personally the most are the preventable diseases that are cropping up right now, like polio, that should not be happening in the United States.
So if you haven't been vaccinated, I always thought it was mandated you had to be vaccinated. You knew my mom, so apparently she fibbed it to me. But she said you were going to get it. But the district used to do it.
Well, it is mandated in New York State that school-age appropriate vaccines occur. So we've clearly identified some gaps in where that had not occurred. And I think that's being addressed again. Well, the outbreak that happened was in Rockland County, right?
Right.
Where the positive case had lived. There's definitely some populations and communities who there are some religious communities.
Okay.
There's travel, right? Because the United States is top of the line in having access to vaccines. Some of the other countries in the world certainly are not. So we have a lot of international travel, and that can influence things as well.
So final word is get vaccinated, wear a mask when you need to, stay home when you need to.
Correct.
Our guest has been Kathleen Cuddy, the Cayuga County Public Health Director. Love to have you back on to talk about other things at your department. You've been very nice enough to send your staff from time to time on other stuff, and we would love to have that. So thank you for doing this, and thanks for being able to come back on. We appreciate it.
Thanks for having me.
We will be back. We'll be off on Tuesday. It's assessment day here at the college, which is a training day. But we'll be back next Thursday with our annual series of election forums that we have planned. For the new 24th Congressional District, we will have hopefully Steve Holden, who has accepted our invitation, but his campaign has said they want to verify that. He's running against Congresswoman Claudia Tenney. We have the candidates the following Tuesday for the new 48th Senate District that has Senator Rachel May and Onondaga County Legislator Julie Abbott have both accepted our invitation, and we're waiting to hear from Justin Cuddy, who is on the conservative line. And then finally, we'll wrap up with the 126th Assembly District. Bruce McBain, who is running on the Democratic line, has accepted our invitation, and we're waiting to hear from Assemblyman John Lamondes. And so we will hopefully bring you those in the next 2 weeks as per past practice. Two things. One, if a candidate agrees and their opponent does not, they get a one-on-one for the full hour with me, and I will ask them the questions. But otherwise, if it's a forum, I'll moderate, and Jeremy Boyer, the executive editor of The Citizen, will be asking questions of the candidates. We'd like to let you know that you can send your ideas for future guests or questions for them, not for the forums, but for Inside Government or Beyond the Front Page. You can send them to cozguytho@aol.com. And finally, as I've mentioned a couple of times this week, we lost a good friend and a colleague here at the college this summer. Doug Brill, who was a graduate of this college, as well as this department's chief engineer since 2005, passed away. For 16 seasons, he made us all sound good. He fixed every glitch that seemed to pop up and was just generally a nice man to work with. He taught hundreds, if not thousands, of students here and taught them how to serve their community. He is greatly missed. We are dedicating this season to his memory. We miss him. I'm Guy Cosentino for Cayuga Community College. I want to thank you for watching. Be safe, get vaccinated, wear a mask when you need to, and stay home when you need to.